Hello everyone, I am Dr. Sandip Patel. Welcome to DocHub in our special initiative of #Subspecialty Focus. Today we are going to discuss on why fellowship after urology is needed. We'll see the current scenario, reasons to think for subspecialty, what all are urology subspecialties, know about fellowships, how to find fellowships and fraternity recognition, and at last certain recommendations while if you are thinking for a fellowship or a subspecialty practice switching off. Let's discuss. So if you are new in our DocHub channel, I would recommend you can see our previous introductory videos related to subspecialty, where we have discussed why fellowship needed in medical practice, the subspecialty in medical practice, where we have discussed different aspects of current medical practice and how the subspecialty can find the space for helping you for developing your career, and the dilemma in subspecialty medical practice we have covered in a separate video, where which all are different factors analysis you should think about, you should analyze about for in a different aspect if you are planning for a subspecialty. So for the urology, the current scenario is the postdoctoral courses after MS, general surgery. There are currently MCH, DNB, or globally if we see in UK and other European countries, there are FRCS in urology is available. So majority of you are might be one of the qualification you are carrying of, and after completing such postdoctoral courses, the job opportunities are in India. If we see the senior resident positions or associate consultant or a consultant positions in a medical college or an institute or a different hospital setup. At a tier 1 city, if we look the currently, you will observe that urology subspecialty clinics, the subspecialty department has already established. There are increasing patient awareness among identifying the subspecialties, the expertise for particular subject among the urologists, and they are preferring to consult for particular subject expert also. Subspecialty fraternity has also developed worldwide, or at national and international societies are already there. Dedicated urology centers or a hospital or an institution, they have different departments of subspecialty clinics, or subspecialty experts are in that particular department. They are managing the patients related to that particular specialty. So now the reasons to think about urology subspecialty. First, there is a practice trend in tier 1 and somewhat in tier 2 cities, and also very well it has developed in western countries, developed countries also. Second is the patient demand from the service aspect, demand for the special attention, for clinical outcome. While managing such demands, if you are practicing as a general urologist and you are every day, if you have a more workload, you are seeing around 50-60 patients in a day, the country like in India or other developing countries where the workload is high, it is difficult to manage such patient demand. Another aspect is the focused practice on particular subspecialty. It will improve the patient satisfaction and clinical outcome definitely. Also, you will observe even as a part of regulatory authorities mandate for the DNB institutes under National Board of Examinations, they who are recognized for DNB urology courses, they also insist from the institution that after successfully running of 3 to 4 years of this particular academic course, the hospitals and institutes should develop the such subspecialty clinics and departments, so it gives the individual the urology residents to give you the enough exposure of such subspecialties. Also, different fraternity recognition has separately developed, like different association or different societies related to this subspecialty. And at last, if you go for such subspecialty, it gives the expert status among the fraternity, that you are particular subject expert, you have different skills and different knowledge in that particular subspecialty. So among the fraternity, among the urologist also, it will be recognized your skills differently. So all these aspect has created an industry need for upcoming urology graduates, where at that part the doctor thinks. That's why we have initiated the hashtag subspecialty focus on our social media campaign also. Now let's see urology subspecialties, what all are different. Urologic oncology and robotic surgery, pediatric urology, endourology, urologic gynecology, reconstructive urology, kidney transplant surgery, functional urology, andrology, neurologic urology, cosmetic urology. So now let's see what should you know about. If you are thinking for the subspecialties, you need to go for the fellowships, because there are degree and other courses are not yet available in India, and also globally, if we see the trend, only the recognized fellowships are available for these such subspecialties. So there are three different types of fellowships. As per the recognition aspect, you will observe that first is the university recognized fellowships, which is in a duration of 1.5 to 2 years of duration in that particular subspecialty. Second type is the recognized fellowships by national or international societies or professional associations and bodies. They are also offering, for the hospitals, they can get a recognition for such fellowships. So the certificate is issued by such national or international societies. And third type is it is offered locally at an institutional or a hospital level. Moreover, it gives you the particular experience, the work exposure in that particular department, and it varies from 6 months to 1 year to 1.5 years. So you can select as per your requirement, but on an average, we recommend that the fellowships, if you are really want to work in that particular subspecialty, the minimum of 1 year to 1.5 year of fellowship full time is recommended. Now, what could be the prerequisites before joining such fellowships? One, definitely your basic qualification, whether you are MCH or a DNB qualified, DNB completed fellow. So either you should have a final certification or a provisional degree certificate, and along with that your medical license or a registration at either provisional or a permanent registration with national or a state medical council. Fellowships are usually full-time, so full-time engagement, so make sure you will not be allowed practice outside the institute or a hospital. That you need to consider, you need to think about it. And stipend policy is as per the institutional policy, and all such fellowships, at least in India, it is not recognized by Medical Council of India or a National Medical Commission. So but yes, it is definitely legally allow you to practice in that particular subspecialty, because you are a qualified urologist with a background of particular qualification. Now, how to find such fellowships? Wherein docthub.com can help you out. You can go to docthub.com under a courses section. You can find all the courses, and you can filter it with your discipline as a medical and different specialty filter. You can search for it and filter it out. In a course type, you can select a fellowships and it will give you the filtered results of available fellowships, wherein you can get the institution detail, brochure, and as well as you can apply directly to that institute. Now let's discuss what all are different fraternities in globally and a national level which recognizes subspecialties. Society of Urologic Oncology, SUO, Society of Genito-Urinary Reconstructive Surgeons, the Endo-Urological Society, International Society of Andrology, International Urogynecological Association, International Society of Reconstructive Urology, Society of Urodynamics, Female Pelvic Medicine and Urogenital Reconstruction, the Society for Pediatric Urology, American Urogynecologic Society, European Society for Pediatric Urology, Society for Fetal Urology, Urology Society of India has also might be coming up with the subspecialty association under its umbrella in a near future. Also we can expect this initiative in India also. And very special case we'll observe at a European Association of Urology, EAU, has a 12 different sections in their under their umbrella, which are EAU Robotic Urology section, EAU section of Oncological Urology, section of Urological Research, section of Andrological Urology, section of Female and Functional Urology, section of Genito-Urinary Reconstructive Surgeons, section of Infections in Urology, section of Urotechnology, section of Transplantation Urology, section of Urological Imaging, section of Uropathology, and section of Urolithiasis. All this section and all such international and national fraternities which we have discussed, it has created an academic environment for an individual. If you are thinking for subspecialties, such fraternities are there to help you out. You can follow their articles, their academic programs, workshops, conferences, has globally and nationally has created a very good environment for the practice. So that's all for this topic today, guys, and please comment below if you are thinking for such fellowships, or if you have any dilemma, if you are doing such fellowship currently, please let us know so other viewers also can share your experience. They can also be benefited with your experience. And what are your views on subspecialty practice, please let us know. And yes, if you have not yet subscribed, please subscribe to our DocThub channel and click on bell icon so that all our new healthcare professional related videos you will get a notification. We are going to discuss on healthcare challenges, career opportunities, upcoming trends related videos. Thank you very much.